to Do I Need a Concierge Doctor, hosted by Complete Concierge Care. I thank you all for being here. A quick introduction. My name is Liam Newcomer. I'll be emceeing and leading this presentation here. I work with the membership enrollment team at Complete Concierge Care. Also on this call, we have a handful of the doctors in our practice that you're going to get a chance to meet in just a moment. I'll let them introduce themselves. We have Chris Gill, a member of our membership team as well. And Dr. Williams, our founder and chief medical officer, is on the call as well. So if questions or anything come up, we have a litany of people that will be able to answer those questions, and a wealth of knowledge on the call to help express what it is that we're trying to say here. So a couple of housekeeping things before I jump too far into it. This is a webinar, so you are seeing us. We are not seeing you, and unfortunately, we're also not hearing you. That does not mean that we don't want to hear from you. We want all the questions that you have. Down on the bottom of the screen, there should be a little chat box, a little Q&A portion for you to put in any questions that you have that come up throughout the webinar. While I'm talking, while I'm presenting, feel free to be putting them in there. Everyone else on the call will be monitoring that. If we can quickly answer it briefly via text, we will. If not, we'll hold it off to the end. We'll have a large amount of time set aside at the end for the doctors as well as myself to be able to answer any questions that you might have. So please ask them. You're probably not the only person on the call who has them. We love answering questions. So as they come up, please answer.
Liam, it's actually the Q&A, not just the chat.
Got it. Thank you for the clarification, Chris. Yes, navigate to the Q&A if you have any questions. Okay, so agenda for this evening, we are going to talk about who we are, who Complete Concierge Care is, who our doctors are. Like I mentioned, they'll all have a chance to intro themselves. We're going to talk briefly on lifestyle medicine, specifically with Dr. Moore. He'll be talking a few slides about what lifestyle medicine is and his approach to care, and then what next steps are in engaging with our practice. And then last but certainly not least, like I said, we'll have plenty of time for questions. So, do I need a concierge doctor? This question is typically asked by people who are frustrated with their current healthcare system, whether that be long wait times, rushed 15-minute appointments where they don't really feel like they get the time they need with their doctor, phone trees when they're trying to reach out and get in touch with their current practice, not being able to talk to an actual human, but just kind of getting kicked around automated phone trees, and just general lack of time and support from their doctor, not feeling like they're really being supported by their current healthcare model. So what we've found are the benefits for our models, the benefits of our model, are really the solutions to these frustrations. So the benefits that you're going to see really boiled down very, very simply is you're going to receive a doctor who knows you, available when you need. So what that looks like from a Complete Concierge Care standpoint is boiled down to three main pillars. It's access, convenience, and care. From an access standpoint, we answer the phone. You're always going to be in touch with a human being. Within 2 or 3 rings, you're going to get someone at our front desk who is familiar with your care, who is engaged and motivated to help you every step of the way. You'll receive 24/7 access to your physician via their cell phone and their email. So, on weekends, on holidays, if it is an emergency, you really do need to speak with them urgently, you will have access to them or someone covering them if they are not able to be in themselves. You'll receive same day or next day sick visits. We reserve space on every one of our physicians' calendars every day so that if you need an urgent or an immediate meeting, you can get in that day or the next day. We do not want anyone who is sick to be unable to get in touch with their doctor and unable to meet with their doctor. Convenience, we partner with Johns Hopkins, and so we utilize the MyChart patient portal, meaning that you have immediate and constant access to all of the results and blood work and everything that comes out of your appointments with us right there to your phone and to your computer. We do our blood draws in the office. We do our vaccines, injections, immunizations, EKGs, really all lab work we do right in office to make things convenient and keep everything in one place for you. And we limit our patient panels. And I get a question all the time, what really does that mean and what benefit does that have to me? Limited patients that your physician is seeing means they have more availability, they have more time for you. Each physician, they maintain a small number of concierge patients, ensuring that they always have the time and the energy and the light in the day to see you. Last but certainly not least is our care. We have extended appointment times. Every new patient appointment will be 90 minutes. Every physical after that will be 60, sometimes 90, depending on need. We want to make sure that all your questions get answered, all your anxieties are put at ease. You really have the time to sit and talk long term with your doctor. All of our physicians will have privileges either at Sibley Memorial or Suburban Hospital, depending on where they're practicing, so that if you do unfortunately ever end up in the hospital, we can come and meet you. We can coordinate directly with the attending physicians there who are meeting you and who are helping you while you're in the hospital. They'll coordinate directly with them and be able to speak with them in person when they can. And of course, we make our referrals and our coordination with complex care easy on you. We want to take on that burden. There's already enough that we don't want you to be doing. So where are we located right now? I know I just mentioned we have our two locations. We are in the Camelier building in Bethesda, Maryland on Fernwood Road. That's actually where I am right now. And then we also operate in Building A at Sibley Memorial Hospital. Speaking of our offices, I do want to now turn it over to introduce our doctors and let them speak a little bit about themselves, why they chose medicine, why they chose concierge, and how they are here to help you. So Dr. Hockman, I'm going to flip it over to you first.
Hi, everyone. Thank you so much for making time this evening to speak with us and ask your questions. We're very excited to have you. My name is Dr. Allison Hockman, and I am one of the physicians over at our Bethesda location. Myself, Dr. Panovic, and soon to be Dr. LaFleur are excited to meet you all and are receptive to any questions that might come up throughout our discussion this evening. So a little bit about me. I am Montgomery. I'm from Montgomery County, born and raised here. And one of my biggest wishes was to come back to this area to practice medicine. I have been practicing primary care, specifically family medicine, for the last 8 years, with the last 5 being here in Montgomery County. I came from a private practice prior to joining CCC. A little bit more about why I chose primary care. I love continuity of care. I like taking care of generations of family members. I like a little bit about a lot of different things in medicine. So primary care was a natural fit. In terms of why did I decide to make a transition to concierge care, in the last 5 years, I've become increasingly frustrated with kind of how primary care operates in this day and age, not having the ability to really spend time with patients, to be available when they're sick, because I had such a large patient panel. And it was really important to me to have the opportunity to be involved in my patients' care, become more accessible for my patients. Since I've been at CCC the last 2 months, it's been really a joy to be able to sit with patients, really get down to the bottom of why they're coming in, having more time and bandwidth to communicate with family members, with specialists, to have the opportunity to pop into Suburban Hospital if my patient is sick, or pop over to their rehab facility to check in on them. It's just been such a wonderful change of pace to be more present with people and to be able to continue to care for people in the best way possible. So I welcome any questions. And if there's anything else, if not, I'm going to pass things over to Dr. LaFleur. Thank you so much for your time.
Thanks, Dr. Hockman.
Hi, good evening. My name is Adrienne LaFleur. I'm a family medicine physician. I'm originally from southeastern Pennsylvania, and made the move down to Maryland, initially to complete my residency at University of Maryland Medical Center in Baltimore, and then down to Montgomery County, where I've been currently in private practice for the past 4 years. Within family medicine, I find, I really enjoy, the ability to complete women's health, as well as complex care management. And so I just found that during my training that those were my focuses and what I primarily do for my patients now. But similar, I would say to what Dr. Hockman had mentioned that, I did find that, in my current practice, it was increasingly more difficult to, really delve deeply with my patients into what was going on with them and really provide them the best possible care that I could provide on a very limited model, the 15, 30-minute schedule. And so I found myself increasingly looking for a way to, make changes to the way that I practice so I could, help my patients. And I found that concierge was going to be the best way that I could do that for my patients. I will be starting at the Bethesda office in July. So I'm not there quite yet, but excited to make that transition very soon.
Thanks. Dr. Panovic, go ahead.
Hello, everyone. My name is Anna Ponovic. Unlike these ladies, I was actually born in Eastern Europe. However, I moved to the States as a young teen and essentially more or less grew up in New Orleans, Louisiana, which is where I attended medical school. I moved to this area for my residency in internal medicine at University of Maryland in Baltimore. I have been practicing medicine for almost 15 years now. All of it was in primary care, which is something that is just something that I always wanted to do, and I knew that it would be the best type of medicine to practice, simply because I like to see my patients go through various stages of life. I like to share parts of my life with them as well, and it just sort of gives me a lot of joy. In terms of my practice, for the past 9 years, up until a few months ago, I was with MedStar, which is a large system you probably are aware in the area. And I enjoyed it until I didn't. And I stopped enjoying it when my panel became so large, when I was not able to limit, accepting new patients while still completely being unable to take care of my already established patients, which put me in a situation of feeling dissatisfied and feeling like I'm not being the best physician I can be and taking care of my patients in the best way that can be done. I think of medicine as both art and science. The science bit involves my learning, making sure that I have enough time to develop myself, to stay on top of all the latest research so I can offer best, highest quality of, latest care to you. And then the art is obviously spending time with you, getting to know you, getting to understand how you want to be cared for, what your core values are in life, and also around the care you wish to receive. And none of that I couldn't do anymore because of the time constraints. So naturally, concierge model became the next logical step. And much like Dr. Hockman, we started together about a couple of months ago, and I have been extremely happy. And I know this is the best place for me, and I think the best place for people to get adequate care. So with that, any questions that you may have, I'm happy to answer.
Thank you, Dr. Lovick. All right. Next up, I'm going to hand it over to Dr. Happel. If you could do a quick introduction about yourself.
Yeah, thanks so much, Liam, and hello, everybody. My name is Paul Happel. I'm an internal medicine doctor by training. My background is I finished my training at Georgetown and then practiced in the Navy for 11 years as an internal medicine doctor. Really enjoyed my time in the service, but decided to transition out to private practice in 2024. And I've been at a private practice up in Rockville, Maryland since then. I'm planning on transitioning to complete concierge care this summer in July. And I'm very much looking forward to the transition for a lot of the same reasons that some of my colleagues have mentioned already. For me, just kind of a big picture perspective on how I look at primary care. I think in the past, primary care has gotten really pushed to the side in terms of its importance in the overall healthcare system. And I think that's really a shame. And the reason being that I think that there are very few things that actually your primary care doctor can't take care of for you. If given the time and the space to really listen to patients, figure out what testing they've already had done, to determine if they need more testing or not, to coordinate with specialists, offhand to sort of figure out whether or not certain things need to be brought to bear with regards to specialty care, or as the case may be, not. And so I think a lot of that coordination just requires a lot of time and a lot of patience. And I think a lot of good primary care happens behind the scenes when you're not actually in the clinic. And so I think that in that case, primary care can be a real force multiplier for patients. But you need a certain model of the way a clinic can run to make that happen. And so I'm really looking forward to making the transition to complete concierge care, to be that sort of healthcare quarterback for patients, and make what can be a very complicated healthcare system a little bit easier to navigate.
Awesome. Thank you, Dr. Apple. And then as I transition and hand it over to Dr. Moore, he's going to introduce himself briefly and then talk a little bit about his specifically lifestyle medicine practice. So I'm actually going to stop sharing my screen now, Dr. Moore, if that is all right with you, and let you take over from here.
Yeah, I realized, give me just a second. I just realized I wasn't quite ready for that. Hang on. Okay. All right, can you see, now let me share my screen. All right, almost there. All right, can you see my screen?
Yes.
All right, we're good. All right, well, thank you, Liam, and I'm excited to be here with my fantastic colleagues at CCC. I grew up in Pennsylvania, and I went to medical school and trained in Philadelphia. For the past 33 years, I practiced academic internal medicine on the faculty of the George Washington University, teaching residents, teaching medical students. And about 10 years ago, I discovered lifestyle medicine, and it fundamentally changed the way I practice. I started the lifestyle medicine program at GW, and I joined CCC to create and run the lifestyle and longevity practice here. In this practice, we focus on two main categories of patients: those who are already dealing with chronic disease and those who want to stay ahead of it so that they don't have to. So look at these two curves. They show you two ways to age. The curve on the left is what we see in standard medical practice. Physical and cognitive function holds up reasonably well, and then somewhere in the late 60s or 70s, it falls off a cliff. The curve on the right is what's achievable with consistent attention to lifestyle. Function stays high a decade longer, sometimes more, and the cliff comes later. One of my mentors used to say, the goal is to die young, as old as possible. The gap between those two curves is what we call the health span gap. For most Americans, that gap is 10 to 15 years. And the point of this practice is to recover those years. And, I'd ask you to think about, which curve do you want to be on at age 70? I want to tell you a little bit about lifestyle medicine. Lifestyle medicine is a recognized medical specialty, and it's the use of 6 core lifestyle factors as primary therapy, not ancillary advice. Those are nutrition, physical activity, sleep, stress management, social connection and healthy relationships, and avoiding harmful substances. Each one of these has decades of research behind it, Each is something we measure, structure, and intervene on systematically. These 6 pillars are the foundation of everything we do in my lifestyle medicine practice. Every biomarker we track, every test we order, every recommendation that we make sits on top of these 6 pillars. So I want to show you, tell you about 2 patients who capture what this looks like. Patient A on the left was a symptomatic, newly diagnosed type 2 patient with type 2 diabetes on 5 medicines, just shy of 40 years old. And his A1C was 12.7, which means that his blood sugar was really uncontrolled. And with 6 months of structured lifestyle intervention, his diabetes was in remission, and many of those medications were gone. That's lifestyle medicine in its classic form: disease reversal in a symptomatic patient, moving to get patients off medication and still controlling their condition. Patient B is different. He's 52 years old, doesn't have any symptoms, came in feeling fine with what we have traditionally thought of was normal blood work, normal labs. But when we look deeper, his ApoB, fasting insulin, and coronary calcium, we found someone who was already suffering with subclinical heart disease and was on a clear trajectory toward active cardiovascular disease in his 60s. But with attention to lifestyle and an intervention over 12 months, that trajectory had shifted completely. He still feels fine. The difference is he'll keep feeling fine for another 20 or 30 years. With both of these patients, it's the same method, the same evidence, but a different starting point. Here are some of the ways we measure where someone is on that trajectory, on their health trajectory. Standard primary care labs tell you whether you're sick today. These measurements help to tell you where you're headed. Things like hemoglobin A1C, fasting insulin, apolipoprotein B, high sensitivity CRP, which is an inflammatory marker, a waist to height ratio, grip strength, and blood pressure. And also through our partnership with the GW Metabolic Lab, we can do DEXA body composition, resting metabolic rate, and VO2 max. And these measures and others used together and tracked over time, that's how we know whether your lifestyle is actually working. So how do we decide, which of those measures make the cut to be on our list? There's a lot of noise in the longevity and healthy aging space: supplement protocols, peptides, anti-aging clinics, longevity influencers. So how do we decide what to measure and how to treat? Well, before any test, biomarker, or therapy enters our practice, we ask 3 questions. First, does it actively and actually predict the outcome we care about in human studies, not just in mice or yeast? Or is it just a correlation that sounds important? Second, will the result change what we recommend? If knowing the number won't change a single decision, then there's no reason to order it. And third, do the benefits of the test or the intervention outweigh the harms, costs, and burdens for a typical patient? Not just for the optimal case, but for typical ones. And not just today, looking down the road. A recommendation has to clear all 3 of these to enter our practice. Fail one and it doesn't, regardless of how popular it is. So at the foundation of everything we recommend are the lifestyle pillars themselves. Diet, exercise, sleep, managing stress, being connected to people in a healthy way, and avoiding harmful substances. Sustained effort and structured measurement is what we do. Even evidence-based supplements don't make much of a difference if the basic pillars are unhealthy. On top of that foundation, we focus on ways of detecting a signal that things are off track before they manifest as chronic disease. So that's what's in the green column here. At the other extreme on the right, things we don't currently recommend because the evidence simply isn't there. Unfortunately, there are plenty of people trying to sell them anyway, but we won't do that. And then in the center column are things we're watching carefully. They're promising, but the evidence isn't strong enough to act on broadly yet. This list updates as the science evolves. That's what we do, and that's what you'd get if you joined our practice. Thanks, and back to you, Liam.
Thank you, Dr. Moore. I appreciate that and great insights.
Let me stop sharing so you can share again.
That's perfect. Yeah, I mean, fantastic insights and really awesome to hear your take on sort of the state of healthcare and your approach to lifestyle medicine. It is always very insightful. So I'll share my screen again, and what I'm going to talk about now is moving forward, right? What are next steps? How do you continue to engage with our practice, and what that looks like? So obviously, and hopefully, as you can tell from tonight, we want you to have a very personal relationship with your doctor. So our first next step is a free, no obligation meet and greet. You get to sit down with anyone or all of our doctors if you so choose. Sit down with them for 30 minutes, one-on-one, talk a little bit further about their care model, how they approach medicine, if that's a right fit for you, and if you want to move forward with that doctor. After that, we have a membership agreement. There's a fee that is paid to be a member of our organization, and then we schedule our initial consultation that I mentioned is 90 minutes to start. So with that comes the face-to-face visits that are then billed to insurance. So that annual membership fee covers the access and becoming a member of our program. And then all face-to-face visits are then subsequently billed to insurance, and we handle all of that for you on the back end. We are in network with Medicare and most major insurances. We are not currently in network with United Healthcare. That said, we do have plenty of patients within our practice that still utilize us, even though they are with United Healthcare. We are just out of network at this time. We have no limits on any of our in-person, phone call, telehealth, anything like that. We do not have a maximum. It's not like you run out at the end of the year of the amount of times that you can see your doctor. Again, we want you to have this relationship. We want you to have access to them as you continue to get your care. So we've got a handful of different care models. I'm really going to highlight two now. The standard concierge primary care, all the doctors on this that you met earlier between our Bethesda and our Sibley location, comes with everything that I've mentioned. All of the concierge benefits, the same day, next day visits, your 24/7 access to that physician, the staff that you can call and get in touch with anytime, is a $2,500 annual membership fee. If you would like to be primary care lifestyle first with Dr. Brad Moore, that does carry a $5,000 annual membership fee, and it comes with everything that I just mentioned, as well as his discussion on the in-depth health and lifestyle assessments, continued growth and research, and continued care through the lifestyle first method. If you would like to see him strictly on a consultative basis, we do offer that as well. That's a $2,500 annual membership. If you would like to stay with your primary care physician, you are particularly fond of them, that absolutely is welcome as well. You can meet Dr. Moore quarterly, have your initial assessments, and have a continued relationship strictly in the consultative role. So these are the models that we have for all the doctors that you've met tonight. So again, what next steps look like is the center one is probably the best, is where I'm going to lead most people to, is give us a call tomorrow. We are open 8 to 4 every day. Our membership team right there, you can speak with anyone on our team, myself included, Chris included, and kind of walk through next steps, schedule that appointment. You can always visit our website. There's a form on there as well, or shoot us an email Feel free to screenshot this page if you want to save it for later or share it with a friend. But the next steps now are get in touch with us any way that you feel comfortable. We would love to schedule you. We have doctors who are new with us. We have doctors that are starting with us later in the summer, like Dr. Happel mentioned. Him and Dr. LaFleur will be starting in July. We'll start seeing patients then. So we can get you in. We can schedule these meet and greets. Just give us a call. We would love to talk with you. So with that said, I know we've got a handful of questions that have been popping up as we go. I will do my best to moderate and kind of see if I can point these out. I'm sure that I am not going to be the best person to answer all of them, but I'll do my best here. So first question, looks like Dr. Hockman, you might have jumped on this one. Do you provide care to all ages, family, or connect mothers to children's doctors?
We were just discussing this yesterday. So at the Bethesda office, I see patients 15 and up. I have some internal medicine colleagues, so I'll let them chime in to let people know what ages they're most comfortable with. And I believe at the Sibley office, they have a cutoff of 20 and up. You could correct me if I'm wrong, Liam.
I think you're spot on.
For me, being a internist, I was only trained to take care of adults, so 18 and above is the ages. I don't have any connections really with pediatricians in the area, so that would probably not be something I could do. But our family doctors probably could. Yeah.
And yes, same thing for myself. I would see patients 18 and up since I am family medicine trained.
Great. I've got another one on here. Is there an advantage to CCC as it relates to specialist referrals? For example, if you make a referral, you'll be seen quicker by the specialist. I have one small thing to say, and then I'll turn it over to anyone else who feels more apt to answer that question. Is all of our doctors really make a point to build relationships in our local community. Most of us have been here for a long time and have really made an effort to make those relationships and know these specialists personally. So, with that said, can we always get you in tomorrow? No, I'm not going to stand here and say that, but we really do our best to build those relationships and have personal contacts with those specialists.
To chime in terms of specialist referrals, as Liam had mentioned, we all are coming from different places. And so we all have different specialists that we refer to, and for myself, and I'm sure a lot of us will kind of agree to this, the best specialist for you is the one that really addresses the concern at hand and they'll be a good fit for you. None of us are tied to any specific organization, whether that be MedStar, where Anna came from, whether that be certain private practices where I came from. We work with people in all different places, all different hospital systems, and the best specialist will be the one that's best suited to fit or address your issue. In terms of expediting referrals, so we ask that all patients attempt to make the appointment themselves first. For the things that really matter, a new cancer pops up or something that's very urgent and you're having a hard time getting in, we have no problem with picking up the phone and calling and doing our very best, but we unfortunately don't have control over other specialist schedules, over other practices. So we do our very best, but I would say no more pull than any other, other group, but we do have the bandwidth and the time to do our very best to get people into specialists when it really does matter. That routine colonoscopy, that routine mammogram, unfortunately, we have no way of moving that up the totem pole. But for the things that are quite urgent, and if the time they give you is not appropriate in our minds, we will do our very best to do the best that we can.
All right, we have another question here.
Liam, is it okay if I just
Please.
piggyback a little bit?
Yeah.
So, and I think that gets a little bit to the point I was trying to make earlier about, what is necessary in terms of specialist referrals. So a good example is, back pain in a busy clinic. You might see your primary care doctor. They'll say, oh, you've got some back pain. Let's refer you to an orthopedic surgeon. They can evaluate you. And while that might be necessary, One thing that is kind of nice about having some extra time is we kind of know at this point what that specialist is going to want in terms of testing. And so we can get that testing done while you're waiting to see the specialist. And so taking a few extra steps to set you up for a successful consultation can save you some time on the back end, even if the appointment itself can't be moved up depending on the specialist's schedule. And so having the time and space to adjudicate those things for you really does make a big difference in terms of decreasing the transaction costs associated with seeing another doctor.
Thanks. I think that's a great point.
I'll take the next one. This one, the question is, I'm young, I feel great generally. I'm looking for two things. One, personalized medicine, and two, to maximize my health so that I can make the best of things as I age. How do you approach care to get personalized care based on personalized data? Well, I think everyone here, everyone in the practice is going to, focus their care in a very personalized way on your specific situation and your specific data. If your question is how to age in a healthy way and how to improve your health span, that's what I specialize in. And we do some additional testing to really identify where it would help you the most to focus. If by personalized medicine you mean sort of testing your genetic profile to determine specifically what foods are going to be best for you or things like that, that's one of those areas where the science is promising, but we're not quite there yet. And it's clear that getting the basics right, those pillars of lifestyle right, provides way more benefit than the small, supplement stack or intervention that's based on your particular genetics. Humans share over 90% of their genome, right? So focusing on those basics is going to get you the most benefit.
Awesome. Thank you, Dr. Moore. I think that's a fantastic answer. We can move on to the next question if nobody else has any insight. I see Dr. Williams is wanting to handle the next question, so I'll let him do so.
Thank you, Liam. The question is, do we file claims with Medicare, and do we provide advice on Parts C and D options? As Liam mentioned, we are in network with Medicare. When I started the business back in 2014, we were enrolled in Medicare providers from the start, and will always continue to be so. As far as providing advice on Parts C and D, yes, the doctors have some knowledge, but our staff have even more knowledge. We do work with a billing company who has a team available to you to answer those questions. We're always willing to help. Sometimes it requires, particular questions about the care you're needing and seeking at the time, whether it relates to hospital-based care and so on. Of my practice, I would say 60% or more of patients have Medicare. So we've always been very in tune meeting needs of Medicare patients. Furthermore, one of the criteria for working with Medicare is that none of our billing for office services ever exceeds what Medicare pays. So there's never any balanced billing going on with Medicare. And then I'm going to move on to the next question as well. And the question is, I want to clarify that you accept the amount insurance pays for those you're considered in network with, such as Blue Cross and Blue Shield. And the answer to that is yes. Now, what differs from patient to patient, there are different Blue Cross plans, are the deductibles. So in this way, as in-network providers, we're just the other surgeon's office or uh, visit. You may have a deductible for the year, etc. And we honor all of those principles of the contract that we have with your insurance companies. Whenever there's a question, if you get one of those EOBs and it says you may owe this, I certainly get those all the time, but that's not a bill. It says this is not a bill. We always have someone available from our billing company to answer any questions that you have. And sometimes something has to be resubmitted with a different code or something of that nature. We always have the staff who have the time and availability to work through those to make sure that insurance is paying for everything that should be done. What we don't do is we don't set fees for office services above and beyond what insurances charge. And if ever there's any discrepancy detected, we want to hear from you and make that correction. Every once in a while, for some reason, a patient gets an odd bill. I remember a patient once sent me a copy of the bill, and it was for something like $4.17, and the sticky note attached. This seems ridiculous, and he's right. That is ridiculous. And we inquired with insurance, but we canceled it either way. So whenever there's a discrepancy, just as the doctors have extra time, our staff has extra time as well. I hope that answers the question. Feel free to follow up. There's no other open questions at this time, but feel free to post any follow-up questions about any of these items as you see fit.
That's fantastic. Yeah, I don't see any other questions here at the moment. Of course, I understand that a public forum such as this might not always be the best space to ask the questions that you want to ask at a time like this. So again, calling us, speaking to someone on the phone, to Dr. Williams' point, everybody that you talk to is going to be motivated and excited to help any way that they can, even if that's not clinical, even if it's just, an insurance-based question. That is what we are geared up and ready to do. I hope that we've impressed upon you the excitement that we have to give you a personal level of care, one that you really do deserve, and one that we are excited to give. So call us. We will be available tomorrow, next week. We can set appointments up for you. We can do our meet and greets with any one of our doctors. We are very eager to talk with you. And I see a couple more questions coming in. I love it. I love the questions. If one needs surgery, does your practice help with rehab steps, as in finding a good rehab center? Who wants to jump on that one? Looks like Dr. Williams is on it.
Absolutely. Now, sometimes the surgeon herself might have a particular preference, especially when it's a hip replacement. Many of the orthopedic groups have their own rehab plans, and we always work with them. We work with a lot of the rehab companies. We work with the surgeon you're seeing from day one. We do the pre-op. We share all the information. And this is just one of the ways we should be your first phone call for all care coordination, whether it's a surgical issue, planning cancer care, where are you going to go for chemo, what about follow-up scans, all of it. We're always ready. We always have the staff who have the training to help you coordinate pre-surgery, post-surgery, as well as other types of non-surgical care plans.
How many patients does each doctor see is the next question. We limit all of our doctors to a panel of 500 patients. That's the maximum they'll see.
So this is Chris. I'm going to just step in as a membership person. We like to say that our doctors have anywhere from 350 to 500 patients, depending on each doctor. And as Liam said, that is the max. Where the average traditional practice has anywhere from 2,000 to 3,000 patients, where that's why doctors have to have 20 patients, in a day to be seen. So that is never going to happen in our practice.
Thank you for the clarification, Chris. That's a great point. Wonderful. Well, it seems like we are starting to reach the end of our questions here. Of course, anything else that comes up overnight, give us a call, shoot us an email. I sent this link to all of you. Reach out to me directly on email if that's easiest for you. More than happy to help. With that being said, thank you again to everyone who came. Hope you all have a wonderful afternoon, and I hope we hear from you soon.